Iphage from Vet Triage. This is going to be posted on February 3rd, 2025. We are going through this issue of Veterinary Surgery from April of 2022, and we are talking horses today. Arthroscopic findings and long-term outcomes in 76 sport horses with meniscal injuries, 2008 to 2018. This comes out of Tufts University. And for those who've never seen horse surgery, I don't know what surgery they're doing in that picture from Davis, but you can see all the size of the team involved, the equipment needed, the space needed for a horse surgery, and they'll do surgery on their side or on their back or whatever. It just depends on what's needed, but just appreciate how much work goes into it to perform these types of procedures. And then the bottom there we have arthroscopic images of from left to right, grade 1, grade 2, grade 3 medial meniscal tears. All right. Objective is to report the findings and long-term outcome of 76 sport horses with meniscal injury, retrospective study, 76 horses, 93 meniscal injuries, 85 stifles. The follow-up involved phone interview for at least 1.5 years post-operatively. Results. The medial meniscus was involved in 82.8% of cases. Grade 1 injury, 76.3%. Overall, 85.5% of horses returned to athletic performance, with 40% returning to previous level of performance. The grade of meniscal injury was associated with long-term outcome. The presence of radiographic abnormalities or additional joint pathology was not associated. 59 stifles were treated with orthobiologics, whether it be autologous conditioned serum or platelet-rich plasma, or bone marrow-derived mesenchymal stem cells. There was no association between using these products and long-term outcome. Conclusion, the overall long-term prognosis is fair. Okay, introduction. Meniscal injury is the most frequent cause of soft tissue lesions seen in the stifle. The combination of ultrasound and scoping has been proposed to best evaluate the menisci and the meniscotibial ligaments in the horse. Scoping is the gold standard. Return to full athletic performance after scoping. Diagnosis and treatment has been reported to range between 27 to 47%. It's very low. Concurrent articular abnormalities include articular cartilage lesions, subchondral bone cysts, cruciate ligament injury, synovitis, and they've all been proposed to reduce the prognosis. Regarding materials and methods, case selection, these cases were from 2008 to 2018. Horses were sport horses, either of dressage, show jumping, show hunter, eventing, or equitation, and the horses had to be over 2 years of age to be in the study. Regarding preoperative evaluation, the pre-op lameness score was based on the American Association of Equine Practitioners lameness scale from 0 to 5. Local anesthetic was injected into the medial femoral tibial joint pouch with 20 to 30 milliliters of 2% mepivacaine. The femoral patellar joint pouch, 40 to 60 mLs of 2% mepivacaine. The lateral femoral tibial joint pouch, 20 to 30 mLs. Surgical procedure, they examined the lateral femoral tibial joint, the caudal compartment of the medial femoral tibial joint, the medial and lateral femoral tibial joint pouches, the caudal pouch of the medial femoral tibial joint and or the femoral patellar joint. Meniscal injuries were graded 1 to 3. These were reported in another study. Grade 1 is injury of the cranial ligament extending into the meniscus but without significant separation of the tissues. Grade 2 is complete injury of the cranial pole, the meniscus, and the cranial ligament, whose limits are visible. Grade 3, severe injury of the meniscus and cranial ligament, which extended beneath the femoral condyle and whose limits could not be seen. In horses with more than one meniscal injury, they took the most severe grade. Frayed and or damaged meniscal fibers were debrided using an oscillating synovial shaver and or monopolar radiofrequency ablation. Exposed cruciate ligament collagen fibers of meniscotibial ligament injuries were also debrided with a motorized resector or monopolar radiofrequency ablator. Loose or unstable cartilage was debrided with manual and motorized instruments. Cartilage fibrillation was debrided with motorized resector or monopolar radiofrequency ablation device. Partial thickness cartilage lesions were not debrided. Okay, results. 76 horses, 85 stifles, 8 horses bilaterally, 68 unilateral. Mostly geldings, followed by mares, and then stallion. Median age 11 years, majority were warm bloods. Left stifle 51.8%. Median lameness grade pre-op was 3. The most common discipline was dressage at 52.6%, then show jumper at 13%. Radiographic abnormalities, 76.8% of stifles, which is 75.5% of horses pre-op. Arthritis was characterized by osteophytes, which is the most common finding at 58.9%. Then subchondral bone lesions, 12.5%. Medial trochlear ridge osteochondrosis dissecans, 1.8%, and other smaller injuries. Preoperative ultrasound found soft tissue injuries in 89% of stifles, including meniscal in 64.6%, and joint effusion in 40%. Cranial meniscotibial desmopathy, 30%, synovitis, 29%, medial collateral ligament, 3.1%, and subchondral bone cysts, cloacae, and 3.1%. And here's a close-up of the image below the scoping. You can see A is grade 1, B grade 2, and C is grade 3. Okay. Scoping findings. 93 meniscal injuries were identified in 85 stifles, including 50.5% left stifle, 49.5% right. Medial meniscus was involved, 82.8%. Lateral meniscus, 16.1%. Grade 1 meniscal injury, 76.3%. Grade 2, 11.8%. Grade 3, 11.8%. Of medial meniscal injuries, grade 1 was most common at 77.9%. Grade 2, 11.7%, grade 3, 10.4%. The most common meniscal injury in the lateral meniscus, grade 1, 73.3%, grade 2, 13.3%, grade 3, 20%. Location of meniscal injury was 86.7% axially located and abaxial 13.3%. 97.8% meniscal injuries involved the cranial horn. Where is it? Yeah, 97.8% meniscal injuries involve the cranial horn of the medial or lateral meniscus. Meniscal injuries was identified in the caudal horn of the medial meniscus in 8.3% of stifles, in which the caudal compartment of the medial femorotibial joint was explored. In joints where the caudal compartment of the medial femorotibial joint was explored, 2.2% meniscal injuries were identified in the caudal horn of the medial meniscus. 80.3% of horses had only one meniscal injury. 17.1% had 2. 2.6% had 3. Of the 15 horses with more than one, 53.3% were biaxial injuries in the same stifle. Additional joint pathology was found in 76.5% of stifles, or 76.3% of horses. Articular cartilage damage, 65.9%, where the most common findings include partial thickness cartilage lesions, 25.9%, chondromalacia, 24.7%, and there were other lesions as well, smaller percentages. All right. Post-op treatment. All stifles were treated with hyaluronic acid, chondroitin sulfates, C4 and C6, and N-acetyl D-glucosamine, autologous conditioned serum, platelet-rich plasma, or mesenchymal stem cells were also used in some horses. Median duration between surgery and follow-up was 2,102 days. 85.5% had some return to athletic performance. 40% returned to the previous level of work and or intended use. 45.5% lower level or different intended use. 14.5% did not return to athletic performance. Persistent lameness following surgery, 36.2% of horses. 5.2% had lameness unrelated to the original injury, and 55.2% had no lameness. Of the horses returning to athletic performance, 40.4% required annual intra-articular corticosteroid treatment. And again, these lameness evaluations post-op are by owners, so not by veterinarians. The reported primary athletic discipline of horses was dressage in 56.4%, followed by hunter in 12.7%. No difference in long-term outcome between reported primary athletic disciplines. Grade of meniscal injury was associated with return to athletic performance. Grade 1 had a better long-term outcome than grade 3. No difference between grade 1 and grade 2 or between grade 2 and grade 3. The presence of articular cartilage fissure in the femoral condyle was associated with a negative long-term outcome. Discussion. These results were in agreement with a previous report where 60% of horses with meniscal injuries were able to return to some level of athletic use, but only 47% were able to return to intended use. Other reports have described similar results with 48 to 75% of horses with meniscal injuries returning to some level of athletic use, whereas only 21 to 38% returned to previous or intended athletic performance. The meniscus plays an important role in lubrication, cushioning, and stabilization of the stifle joint. Multiple forces have the potential to cause meniscal injury, including meniscal compression between tibia, changing contour of the distal femur during extension, or shearing forces from cranial translocation of the meniscus, or tension transferred from the meniscotibial ligament to the cranial horn of the meniscus, or other forces not yet described. Another study demonstrated the medial meniscus moves significantly during the final 10 degrees of stifle extension, with the cranial horn of the medial meniscus undergoing significant craniocaudal translocation. The fixed axial ligamentous attachment of the menisci to the cranial tibia causes the menisci to change shape during movement and results in significant axial compression and cranial translocation of the medial meniscus, entrapping it between femur and tibia. In this report, injuries involve the medial meniscus in 83% of stifles, consistent with another study, and is similar to previous reports of 60% and 77%. The percentage of meniscal injuries diagnosed as grade 1 was 76%, which is higher than previous reports of 37.5% to 50%. The abaxial component of the meniscus receives greater tensile forces than the axial component, with significant increases in tensile forces applied to the abaxial component of the medial meniscus when the limb is hyperextended. The majority of meniscal injuries, 86.7%, were located in the axial half of the cranial horn of the meniscus in this study. The presence of articular cartilage damage was previously associated with poor return to function for athletes. However, another study did not find association. Another study reported that 62% of horses were found to have concurrent medial meniscal injuries with subchondral bone cysts, while only 2 developed subchondral bone cysts after meniscal surgery. Horses with both a meniscal injury and a subchondral bone cyst appear to have a worse prognosis, with 47% of horses returning to some kind of work, but only 21% intended work. Autologous conditioned serum significantly improves lameness following experimentally induced osteoarthritis. The use of platelet-rich plasma in equine joints is targeted at returning anabolic catabolic homeostasis in the intra-articular environment. Multiple studies have assessed the effect of platelet-rich plasma on equine joints with arthritis with varying results. A report on intra-articular bone marrow stem cell in horses with stifle injuries revealed 75% of horses with meniscal injury were able to return to some level of athletic work, including 62% of horses with grade 3 meniscal injuries. Additional diagnostic modalities include standing needle arthroscopy, CT scan, MRI. So just like other retrospectives, there's the problem with retrospective studies where not everything is standardized. Not every horse got the same diagnostics before surgery or the same treatments with the biologics. And obviously we always want more horses involved, but otherwise it's a good study. And I learned a lot from this one. So thanks everybody who's watching, and we'll see you in the next one. Take care.